All right, we're going to get going here. It is 7 o'clock and we're going to start it right on the button here. I appreciate you joining me tonight to talk about this important topic. We've been doing this for the entire length of COVID, and it's been a great way to interact with people. We used to do these in person, these workshops, and we would get a lot of people to show up. And it was a great way to be interactive, and living in an online world is a little bit different. Interaction's a little bit different than being in person, but we found it's a great way to get information into the hands and brains of people that need to hear it. You are a part of the inaugural session here, though, talking about neck and headache pain. We've done this for lower back pain. We've done this for shoulder pain. We've done this for ankle and foot pain. And we've done it for knee pain, but this is the first time we've ever done it for neck pain. So I'm excited to share this information with you. Let me share my screen so you can see what I have here, and we're going to go through this information together. This is the Truth About Neck and Headache Pain workshop that you've been promised to receive information about. As I said, interactions are really important, so there are ways to contact me. You can hit the chat button at the bottom if you have any questions. I'm going to be asking some poll questions. Those are anonymous, but I want to get your information. Any questions, any information you want to provide me about your neck and headache pain issues. And then at the very end, I'll give you my contact information so that you can reach out to me and communicate with me directly as well. Who am I? Well, I'm a doctor of physical therapy. Troy Vander Molen is my name. I've been doing physical therapy for quite some time now, about 24 years. In fact, the end of November will be my 24th year on the button. So I'm excited to be celebrating that anniversary here soon. I'm a 1996 graduate from the University of Iowa Physical Therapy program, and about 7 years ago got my doctorate of physical therapy degree as well. I feel blessed to have received the education I received from the University of Iowa. It's consistently ranked a top 2 or 3 program in the nation, and I learned a ton there. But I'm happy to tell you that what I'm going to teach you today is stuff that I've learned through 24 years. I treat people with all kinds of conditions, including neck pain, far differently today than I did 24 years ago. And the reason is you can learn about stuff in the books. You can take that information in and apply it as much as you want to, but until you've actually worked with people for an extended period of time, it's difficult to understand how it truly impacts people's lives. And so you're going to get that information tonight. The information that I've learned through working with lots of people with neck pain over the last 24 years. I wouldn't exactly call them secrets. However, what I'm going to talk about today, you will not hear in very many locations. We'll talk a little bit about why Western medicine can be effective for temporary benefit, but is not particularly effective for long-term health. And I'm going to apply the information I've learned over those 24 years on how to give you solutions to neck pain and headache pain problems that aren't just temporary, that they actually give you long-term benefit. And I think that's really important information to learn. It's information that I share with a lot of people. I work with a bunch of other people, including about 20 other physical therapists, along with occupational therapists and assistants and athletic trainers and the like. And we all have this information. This is information, this is a treatment philosophy that we use regularly. And I think it sets us apart in terms of helping people deal with pain, not just in the temporary, but in the long term. Lower back pain and sciatica is the single greatest reason that people come to see us, but neck pain issues are tied for number 2 with shoulder pain issues for reasons that people come to see us. And I did a little math in the last 3 years amongst all of our 7 locations. We now have 8, but this new one's just starting in a week or so. I'm estimating that in the last 7 years, we have seen about, in the last 3 years in our 7 clinic locations, we've seen about 20,000 people, or done 20,000 sessions with people that are experiencing neck pain. So it is a really, really common thing. And I'm excited to share the information from you because I think it's beneficial. I want you to know that this workshop is for you. If you're finding that your pain is gradually worsening to the point where you're not doing as easily or as much as you used to do, that means you're becoming a little bit more dependent upon others as time goes by. And so if you want to become more independent, if you value your independence, you don't want to become more dependent upon others because of this issue as time goes by, then I encourage you to maintain your time here and stay with us as we go through this information. It'll be really important. Having a little issue here, so I apologize. Glad that you're here. Secondarily, if you're asking tough questions because of your neck pain issues, questions like, man, is this ever going to go away? It's getting worse. I want it to get better, but I'm losing hope. Those are questions I hear a lot. Those are honest questions. And honestly, questions that if I were in your shoes, might be asking myself. I hear the question a lot, do I just need a surgery? Is there a surgery I can do to just put it in my rear view mirror? I wish there was. I wish there was a simple solution, a quick solution, a snap your fingers solution. I'm not going to give you a get better, quick fix solution because one doesn't exist, but I will be able to give you some hope tonight by sharing some really important information for you. Sleeping is a really big problem for some people that have neck pain issues. And if you don't sleep well, it affects everything. Sleeping is our healing time. Sleeping rejuvenates us, gives us energy for the next day. So pain that bothers us at night zaps us of our energy, and it helps exacerbate the condition, which is not a good thing. And so if you're sick and tired of pain ruling your life and you just don't know where to turn, then this is a great place for you to be. We also know that any musculoskeletal issue, whether it's a back pain, a knee pain, or a neck pain issue, changes the way we move and how well we move, how frequently we move. And therefore, it has an impact on our overall health. And so if this is not just about neck pain, it's important to get that neck pain information, but this is a whole health type conversation as well. And we know that when these musculoskeletal issues advance over time, and they do, because as you'll learn in just a little bit, they're cumulative issues, it has a negative impact on more significant things as well. Ultimately, I want you to feel better and function better. And I think that's why you're probably all here. And if you can feel better and function better without the need for medications, injections, and surgeries, then you don't have to worry about the high-risk procedures and side effects that can come along with some medications. Now, there are times that people come to this workshop because they're being forced to come here. Someone's nudging them and saying, I need you to be here. And while I appreciate that you might have someone that wants you to be here, if you are not ready to be here, this may not be the place for you to be. If you're looking for that get better quick or that quick fix solution, again, I wish I could tell you that. There just is not a good option for that. If you're hoping to find a way to mask your symptoms and don't want to really get involved in putting in some time and effort and making it go away, this is probably not the place for you. And if you are one of those people that say, I just need the surgery, well, I wish that was the case, but that is unlikely to be the solution that benefits you over time. I'm going to fast forward a little bit through some of this stuff. I want to ask you an important question, though. In fact, I'm going to ask you 3 questions, and I'm asking those of you online right now. You can click that chat button at the bottom, and I want you to answer these 3 questions. Now, the reason I'm asking these questions are because these are the questions I ask everyone that comes into the clinic who are dealing with neck pain problems or knee pain or back pain problems. The answer that you give me to these questions will help me understand, is what I'm going to teach you tonight going to be beneficial for you? So tell me, in the last couple of weeks, what thing has bothered you the most with regard to your neck pain? Okay, what activity, a specific movement, posture, what thing is the hardest with regard to your neck or headache pain? Number 2, how bad does that pain get at its very worst? On the 1 to 10 scale, 1 being almost not even noticeable, and 10 being get me to the emergency room now. How high has your pain gotten in the last couple of weeks as a result of this issue? And then finally, how long have you been dealing with this neck and headache pain issue? Has it been weeks, months, or years? Okay, so now is the time to be a little bit interactive. Share with me a little bit. I want to know your answers to these questions because it will help me understand if the kind of neck pain that you're dealing with is something that my expertise can be beneficial for you. So we got any brave souls that want to share a little information with me? Okay, Betty, a 10 out of 10 pain. That's a big pain, Betty. And being on your personal computer for hours, reading, the left side of the neck in particular. Yeah, even with short periods of reading. Okay, yeah, this is actually one of the issues, Betty, I hear a lot. Computer and reading are difficult. As I alluded to earlier, sleeping can be problematic. There are specific movements of the neck that people don't like. Quite often looking up towards the ceiling is a painful position. So that's something that I hear about quite a bit. Okay. David is saying lifting the head from a downward position. So when it's been down, you're lifting it back up. It can get to a 6 in about 3 or 4 years. Okay. Now it's kind of funny. You guys are giving me answers that I expect to hear. But it's kind of funny to say this, but this is definitely true. If you have a pain in the neck that can be attributed to a specific activity, a specific position, or something of the like, that's actually not bad news. It can actually be good news. Good news because it's fixable. I tell people that if you have pain that can be reproduced with something, then you can actually likely have pain that can be reduced. If it's reproducible, it can be reducible. That's because it's a mechanical problem. And I wrote down here the 4 most common things that I see or that people tell me are bothersome for their neck. And you've seen, you can see many here. I've already mentioned driving a car because of looking back and forth can be problematic. Just sitting in a chair. We'll talk a little bit about postures and how sitting contributes to postures that put stress on the neck. Okay, let's talk very briefly about 2 types of trauma. One we're going to spend a ton of time on because it is the most common type of trauma that contributes to neck pain issues. But let's first talk about the other one, acute trauma. Okay, what we're seeing here is tissue damage over time. With acute trauma, you get sudden onset of tissue damage. There's one thing that brings on an acute trauma issue. So you see it's there, and then as time goes by, it slowly gets better, and eventually you get below the symptom threshold. The nature of acute trauma, which by the way is the kind of trauma you think of when you hear the word trauma. If you experience a trauma, you think about something very painful, something sudden, a motor vehicle accident, falling from a height, those kind of things. That is acute trauma, and it's easy to know what caused it because it happens and the pain is immediately present after it happens. But because we're living organisms, we're made to get better. Once the thing that brought on the problem is removed, the body kind of goes through the healing process. Acute trauma issues naturally get better. Unfortunately, most neck issues are not acute trauma issues. They are instead cumulative trauma issues, and they look different. What you see here, this gradual increase in tissue damage over time, that may take months, if not years, to develop. There's a few points I want to make. First of all, there are changes happening below the symptom threshold that you're not even aware of. They don't register yet. We're not cognizant of them. Changes are occurring due to not one thing, but the exposure to the same thing, the similar stresses over and over and over again. And when they first start to notice it, when they just get above the symptom threshold with this cumulative issue, people will tell me, well, it's not horrible. It's not terribly frequent, not too intense. It's a short duration issue and then it goes away. But as time goes by, because cumulative issues are the result of similar stresses over time, not one incident, but many small incidents, the natural course of this cumulative issue is that as time goes by, it's going to become more frequent, more intense, and longer in duration. Let's use this bucket analogy a little bit here. A cumulative trauma, like neck pain, in most instances is very insidious and slow, but it's also very predictable. The first thing that we notice as our bodies start to adjust and accommodate and change as a result of stress over time is that we're more fatigued. Okay, I'm 48 years old. I've been a physical therapist for 24 years. That's half of my life. And I can tell you, even though my job's not physically difficult, I am more tired at the end of the week now than I was 24 years ago when I started as a physical therapist because I'm aging. My body is changing. Fatigue is the first thing we notice. And we downplay that. We say, you know what, I'm not as old as I used to be. Of course, I'm not going to have the energy I had when I was in my mid-20s. And so we just keep doing stuff and tissues continue to change and there's more water in the bucket. The next thing we notice is that we're no longer tired, just tired. We might be experiencing some stiffness and soreness. Okay, you remember when your pain was less of an issue and you just had minor stiffness and soreness from time to time? That's the next stage. And again, people tend to downplay that. They make excuses for it, or to some degree, they ignore it. They ignore it as long as they can until more water fills the bucket And now we're truly experiencing pain. Okay. Now, the next step after pain is tissue injury. This is stuff that's going to take more time, effort, energy to deal with. What I'm going to do tonight is to push you in that direction. What can we do to get water out of the bucket, to build your bucket up so you can catch more water? How do you truly deal with cumulative trauma? That's what we're going to deal with tonight. That's what the question we're going to answer tonight. But the reality is most of you here tonight are on this path. The frequency is getting worse. The intensity is more significant. It's a longer lasting duration. You can see on my screen there, we got the train tracks. And if you look into the distance there, rounding the bend, there's this train setting its sights on us. This is the path you're on. And eventually this tends to get worse. This is absolutely the nature of cumulative trauma. It will get worse unless you change the root problem. Okay. And when it gets worse as time goes by, our mood gets worse, which impacts the people around us negatively. Our overall activity level decreases, which means our general health is worse. And the likelihood of having a high-risk procedure goes up as time goes by. And unfortunately, all of those things happen, even though they're avoidable. And any solution we find to that doesn't involve getting to the root of the problem is only temporary, which means essentially you're wasting time and money. So I'm going to talk about a structured process that talks about getting to the root of the problem. But I'm going to share one key nugget of truth right here. The root of the problem is movement. How to move well to take stress off the body part. So imagine you are driving down the road in your favorite vehicle, smooth sailing, a perfect day, weather's nice, couldn't be better, until a little light flashes in your dashboard. Okay, it's the check engine light. Well, you've seen that light before, you don't trust it anymore, and so you keep going. I know I've done that before, I've ignored it. That first warning sign is getting ignored. And eventually, as you continue to drive, you start to smell something under the hood, maybe see a little smoke, maybe you're hearing a rattling that's starting to get a little bit more significant. What should you do in that case? It's definitely there, it's more significant. If you're smart, you pull off on the side of the road immediately. But what some people tend to do, if I'm using this analogy to talk about how we deal with cumulative trauma in the human body, it would not be smart in this situation with a car on the side of the road to open up your hood, to open up your trunk, to pull out this big thick blanket from the trunk, throw it on the engine, close that hood, take a piece of duct tape and cover up that check engine light. You know, see no evil, hear no evil, smell no evil. All we're doing is getting rid of all the signs that something's really wrong with this car. But getting rid of those signs does not make the problem go away. Yet this is how we deal with most musculoskeletal issues in Western medicine. Okay, so I'm going to give you what I believe is a much better way to get to the root of the problem and make it go away once and for all. And the good news is if you do this, this is good for your overall health because movement impacts your musculoskeletal health, which is easily the #1 healthcare expenditure in America right now. But movement also positively benefits 5 of the top 6 healthcare expenditures. The things that contribute to 86% of healthcare costs in America are all positively influenced by moving better. And we're talking about heart disease, diabetes, obesity, and depression, and even to some degree, some cancers as well. And that's the 6th of the top 6 issue. But you are not going to get any benefit unless you get to the root of the problem. Let's talk about how most people deal with problems. Okay, I've already alluded to this fact. When we start to feel something, we'll just ignore it. We don't want to be a squeaky wheel. We've had some pains before. It's going to go away. Sometimes ignoring it sounds like excuse making. You know, I'm not as young as I used to be excuse, or I work hard, what do I expect? You know, a little pain's normal. Or my mom had a neck problem and I should expect to have that myself. That's the way people deal with it as long as they possibly can. If you've gotten to this point and you're listening to me talk here tonight, you're probably done with the ignoring it stage and you're trying to find some solutions, and I applaud you for that. Early on, most of the solutions that we seek, unfortunately, are alter the problem, not truly fix the problem types of solutions. Go online and search solutions to neck pain, and you will understand it's a multi-billion industry of people trying to sell you something that's going to make your pain go. But most of the things are not things that get to the root of the problem. They just mask the problem. Even in medicine, this is the case. Medications, injections, and surgeries all mask the problem, alter the problem, do not get to the root of the problem. So what we're going to talk about the rest of tonight is getting to the root of the problem, truly solving it. I'm going to encourage you to find ways to solve it as well. This is one of the most important points I can share tonight. Okay, if you start to get a neck pain, you don't pull your shirt open and say, oh, look at that dial. Got a dial inside of my neck. I'm low in ibuprofen. I've got to pop that ibuprofen up just a little bit more. And if I get that ibuprofen back up to where it needs to be, I'm going to feel better. That is trying to deal with a mechanical problem with some kind of a medical solution. You cannot successfully manage something that is biomechanical with a biochemistry solution. That only masks the problem. It does not get to the root of the problem. So what we're going to talk about tonight, hold on just a second, folks. So what we're going to talk about the rest of the night is that movement-based problems need to be treated with a movement-based solution. That's the only way you're going to get to the root of the problem. Now, one of the things we're tempted to do is when we start to hurt is to pop some pills, even some over-the-counter pills. Believe me, I've been guilty of that in the past as well. But I want to tell you a little story about how healing occurs. I'm not going to go deep in the woods about the science of healing, but look at phase 2 here. Healing at every level, whether it's a superficial wound or a deep tissue injury, it goes through 4 stages, 4 phases. And the second phase is called inflammation. Inflammation is a normal part of the healing process. If you experience inflammation, the body is preparing to inundate the area with blood vessels. And blood vessels are necessary. You need this growth and proliferation of blood vessels to bring blood and all the nutrients that that blood brings to the tissue for long-term health. And so if we take an anti-inflammatory and we stop the inflammation process, we stunt the proliferation and the maturation phases of healing. So it's an incomplete healing process. That means that that tissue does not have what it needs for long-term health, and it's likely to return to problems in the future as well. One of my favorite authors of all times has been gone for a long time. He wrote mostly in the early half of the 20th century. C.S. Lewis is his name, so maybe some of you are familiar with him. In the time of World War II, so the early 40s, he wrote an essay called Miracles. And this section comes from that essay. He said, the magic is not in the medicine, but in the patient's body. What the treatment does is to stimulate nature's functions or to remove hindrances. So what's he saying there? He's saying that a physical therapist is not a magician, a chiropractor, a medical doctor. We don't have special magical powers, okay? If we're going to do anything for you that's beneficial for you, if we're going to give you successful treatment, we're going to either have to do something that encourages the body to do what it was designed to do, or prevents the body from experiencing the natural healing properties that are inherent in the body. So think of that from the anti-inflammatory standpoint. Inflammation is normal and necessary. If we stop the inflammation, we stop what is normal and necessary. We are not stimulating nature's functions, we're stopping nature's functions. We're not removing a hindrance, we're adding a hindrance. So I will tell you, anti-inflammatories are fool's gold. They will make you feel better temporarily, but we need the healing to fully take place for long-term good. Let me tell you a brief story, and I think this is going to be helpful because Nathan's story will help you understand how to get to the root of the problem just a little bit better. Now, I saw Nathan, it's probably been 6 or 7 years ago. Nathan was in high school at the time, and he had been struggling. This is not his true picture, by the way. I stole a picture. It looks a little bit like Nathan did, so it reminded me of him. But he had been struggling with neck pain and headaches for a couple of years. He was a junior, and it was most of his high school life, and they were really bad headaches, and never fully went away, but definitely were worse at times. He'd gone to doctors and specialists, seen neurologists, and just been dealing with a lot of issues related to the neck pain. And every treatment he sought gave him hope, but didn't create solutions for him. He was given medications, they tried injections, went back and tried different medications, and he was pulling out of activities. He wasn't hanging around with friend groups, wasn't able to study like he wanted to. He was a smart kid, but the headaches were starting to take over his life. And to make a really long story short, I don't know if he was clinically depressed, but he was definitely showing signs of that. He was referred to us kind of as a last-ditch effort. He came to us honestly pretty skeptical, and I don't blame him given his history. But we did our typical assessment. I did my typical assessment of him and found an issue that had been ignored up to this point, and it was related to his hips, and it was actually a hamstrings issue. So the natural question you would ask is, how in the world do hamstrings have to do with neck pain? Well, I'll show you that information a little bit later on tonight. But I think this is an important point. The area where you have the pain is usually not the area where the problem truly exists. He was experiencing stresses at his neck that were caused by issues external to the neck, okay? And every treatment he had focused on the neck and looked at the neck inside the box. But the treatments had not understood that the neck is influenced by everything around it. So remember the song we always sang with the kids, the neck bone's connected, the ankle bone's connected to the knee bone's connected to the hip bone's connected to the backbone. This is the human body. Your neck is not an independent structure. It is a part of a dynamic system. And in Nathan's case, the area that had the problem was his hamstrings. And I'll show you exactly how that occurs. And I'll tell you, if you've had neck issues before and you haven't had somebody look beyond the neck at what's going on to identify how to take stress off the neck, you've likely ignored the primary cause of your problem. And so this leads me to the question, why do I teach this stuff? Well, number one, the musculoskeletal issues, the comments that it hurts when I move, when I do this, that's the number two reason that people go see their doctor, their medical doctor. And I have great friends who are medical doctors, 2 family practice doctors, 1 emergency room doctors, and I am in awe of the breadth of knowledge they have about the human body. They put me to shame. But the well of depth in musculoskeletal stuff is really, really shallow. And it doesn't make sense to me. So the number 2 reason that people go see the medical doctor, you'd think there would be more training in musculoskeletal issues. There just isn't. And so doctors will refer people, they'll give them medications, they'll give them diagnostic tests, they might refer on to specialists, none of which are equipped to get to the root of the problem very well. They're just poorly trained to deal with those musculoskeletal issues. And we know that opioid epidemic is a major issue. It's killing people. It is a medication that masks pain but does not get to the root of the problem. That needs to stop. I would encourage you to look up Keep the Wolves and Opioids Away. There's a video made by a group in Colorado, I think 4 years ago. 2 statistics in that video stick out to me. Number 1, Americans make up 5% of the world's population, but they consume 80% of the world's opiates. That's quite skewed, isn't it? Now, of course, some of that's heroin, the illicit drug use stuff. Other of it is prescription medications. So, and then the other thing is, if you get a prescription for an opiate, for a narcotic, of those that get prescriptions, 1 in 4 develop an addiction. So we need to stop with that stuff. It is killing people and it's not getting to the root of the problem. There's a much better way. Surgeries are getting more and more common. They've more than doubled in the last 10 years. Unfortunately, they're not particularly successful because we know that there are a lot of people that have issues that they can find on a diagnostic test that are not at all correlated with pain. So getting rid of that issue does not eliminate the pain. Again, I'll say movement-based issues need movement-based solutions for movement-based experts. This is something I just found last week, actually. Unfortunately, the COVID epidemic is being negatively influenced by COVID. People are isolating. They're not getting out as much, particularly earlier this year. They're not getting to the doctor. They're dealing with pain or other depression-related issues that come with isolation as well. Unfortunately, this is going to be, we're probably going to see these statistics go up in 2020 when it's all said and done. Seeing a couple comments come through. Betty says, how much do appointments cost? Do health insurances pay well for our staff services? We'll talk about that at the end, Betty, so I appreciate that question. All right, so let's get into the meat of the topic tonight. We're going to talk about the most common types of neck pain and headaches, the most common causes, and that's actually the most important topic that we're going to speak to tonight. And we'll talk about what successful treatment looks like, treatments that understand what the true causes are and seek to change that. Let's first talk a little bit about the design of the cervical spine, your neck, okay? It's a three-dimensional mover, just like all body parts are. It's a very mobile area. You can see that. Sagittal plane movement, that's the nodding motion, flexion and extension. We can go 45 degrees in each direction, so there's a total of 90 degrees in that sagittal plane. The frontal plane is 45 in each direction or so that's about 90 degrees. Rotation is the big one. Our neck is made to rotate quite well, so it's about 80 degrees in each direction, give or take. So that's 160 degrees of rotation. That's a lot, okay? So here you can see that, the up and down, 45 in each direction, rotation 80 degrees in each direction, the tilting left and right in the frontal plane, 45 degrees in each direction. So it is made to move most significantly. It's the most significant moving part of the entire spinal creature. We've got 7 bones that make up the cervical spine. 12 below is the thoracic spine. So that's what our rib cage connects to. It's kind of our mid-back. The lumbar spine below that is 5 segments. But the cervical spine, 7 segments, are the most mobile segments in the entire human body from spine standpoint. So let's talk about the 3 most common types of neck pain and things that contribute to neck pain and headaches. We're going to talk about disc bulging. We're going to talk about arthritis. And then we're going to talk about suboccipital neck and headache pain. Please note that all these things are just simple descriptors of the most common types of neck pain. There are multiple causes of each of these types of neck pain. So you cannot treat a disc bulge knowing nothing more than that it's just a disc bulge. You got to get to the question behind the question, which is what we'll talk about when we talk about the cause. I unfortunately did not get my poll questions loaded tonight, so we're going to skip right over those poll questions. Let's talk about the disc bulge. I'm going to move myself out of the way here. So what you can see from a bird's eye view here is kind of the cross-section view of the spine of the neck. You can see you've got the disc here, and then the spine itself. Below that disc, you've got the vertebral body. That's the bone. You've got these lateral projections called the transverse processes, and then you got the posterior processes too. But what I want to point out to you here is that the disc area here, when we're younger, is quite mobile. Some people would call it like the jelly inside a jelly donut. It's a little bit more like crab meat. And then when we move, the material within there that's a little bit more mobile moves around. And so you can see the bulging usually affects the posterior lateral portions. This is showing a right posterior lateral bulging. And if it gets more significant, this is a true herniated disc. A bulge is just a little herniation, but a true herniated disc pushes all the way out, and it's going to hit against this nerve that exits. We have a nerve that exits right and left between each vertebral segment. And that's when that nerve gets pressure from something, is when we start to get symptoms down the arm. So it's not at all uncommon with disc bulges or herniations or some version of those things to feel pain going down the arm, numbness and tingling down the arm. That's the equivalent to sciatica down the leg. It's sciatica of the upper extremity, so to speak. Okay, with this condition, because when we bend forward, that pushes that disc material backward, forward bending or looking down is problematic for these people. Now, unless you are 35 or below, this is unlikely to be the case for you. Most people that are symptomatic with disc-related issues are going to be 35 and below. They will also experience side bending, particularly in the same direction. So if the right-sided problem, side bending to the right, coughing, laughing, sneezing also increases pressure on that tissue. So that's going to contribute to the symptoms going down the arm as well. Though that's not desirable to have pain, numbness, and tingling down the arm, but it is not dangerous to have that. It becomes more dangerous when we start to get weak or have a hard time controlling grip and hinge, which is exceptionally rare in the cervical spine. Now, many of you here, if you've been dealing with it for quite some time, maybe you've been told in the past you do have some disc bulging issues. I will tell you, maybe when you were 35 or below, it was probably a disc bulge. If you're older, it's probably developed in the second thing we're going to talk about next, which is the most common thing. But please know that you are not alone. A lot of people have these things. In fact, an MRI study done within the last 6 or 7 years showed that 69% of people older than 64 have disc bulging, but no pain at all. So in other words, it's more common to have disc bulging and have no pain than it is to have a disc bulge and experience pain. So I always tell people, why have a surgery to get rid of a disc bulge if most people who have disc bulges don't have pain? There is not a direct correlation between those findings in a diagnostic test and the pain that you're experiencing. There are other reasons for that pain, which we'll talk about in just a little bit. In fact, here's a little more information. This is MRI studies that have been done on people that have no pain at all. And you can find that degeneration of the disc is really common. It becomes more common as we get older and older. There's the disc bulge. If you are 50 years old or older, you are 60%, 69, 77, 84% likely to have a disc bulge, even if you don't have pain. So these things are exceptionally common and are not an automatic reason to have a surgical intervention done. The surgical intervention happens when you get beyond just the pain, numbness, and tingling and start to have a change in motor function or muscle function. Now, the second common type of neck pain is actually the most common, easily the most common. If we have people on the workshop tonight that are 50, 60, 70 years of age, this is very likely your issue. When you have arthritis, there are degenerative changes that are starting to occur. So you'll hear things like bone spurs or disc degeneration and those kind of things. What you're seeing here is a nice, pretty disc between two vertebrae. This is from the side view. You can see this hole called the foramen from which the nerve root exits. That nerve root joins up with others to develop three major nerves that travel all the way down through the end of the arm to the fingers. This is a nice, pretty one. I want you to know that changes to the disc, changes to the vertebra and all the other bony segments as time goes by are normal. In fact, it's as normal as having wrinkles on the skin. But if some of those degenerative changes, intervertebral disc breakdown starts to put pressure or encroach upon this exit point for the nerve, then when you move that thing, which either closes or opens up that hole a little bit more, you could get more or less pressure on that nerve root, which contributes to some of these symptoms down the arm. Now, a true disc bulge or herniation is a younger person's problem. But if you're older and you've got this occurring with similar types of complaints, you probably have the stenosis or arthritis related issue. I want to show you, this is another artist's rendering of some common degenerative changes or arthritis related changes that tend to affect that nerve root as it exits the side of the spine. Now, stenosis literally means narrowing. So anything that's causing stenosis is narrowing that exit point for the nerve. It's called the neural foramen. There are three ways that we, just by moving, either close or open up that exit point just a little bit more. Let me show you this brief video. It's actually going to show it down here, the movement between L3 and L4 at the lumbar spine. Your cervical spine's up here. But the movement that occurs here is just the same as the movement that happens here. So I'm going to start this. It's going to zoom in to L3-4 here. You can see the disc. Here's the exit point. It's extending, backwards bending. That's closing it down. Forward bending, which would be looking down. If it's a cervical spine, really opens it up. Okay. Side bending to the left is going to close down this left foramen. Side bending away to the right will open up that foramen. Now this next one's harder to see, but rotation does the opposite thing. With side bending towards, it gets smaller. With rotation towards, it gets larger. With side bending away, it gets bigger, but rotation away, it actually gets smaller. You can't see it very well from the angle that was shown from this particular one, okay? Understand that anything that encroaches upon that thing can be a problem. And I will tell you that answering the deeper question as to why there's physical stress that's creating a change to that tissue is the important question that must be answered. All right, so we've talked about disc herniations and bulging. We've talked about arthritis. Let's talk about suboccipital neck muscle and headache. Okay, so let's take a look here. These are your 7 cervical segments from C1 all the way down through C7. You can see this complex of nerves that travel through this area and come up to the back of the head. So some are coming up to the top of the head, Some are coming up kind of behind the ear. For people that have this kind of pain, they will feel pain in the back of the neck, high on the neck, and it will travel up from the back of the head, coming up forward to the top of the head or even behind the ear. This one is not at all associated with numbness or tingling or pain down the arm. We do not experience arm symptoms of this type of issue. But we could have both head and neck pain, or we could have headaches associated with this as well. Usually activity increases it, and end of the day is worse than the beginning of the day because we've been up and about. If you have this issue pushing these muscles in the back of your neck, you'll feel the discomfort. Sometimes that elicits some of that headache pain on the posterior side as well. This affects people of all ages, and it does not show up on an MRI. You will see nothing on an MRI. Nathan, the gentleman I was telling you about, the high school kid, had this. When he went to these experts, he was being told that he had a migraine, but it was really a suboccipital neck issue. When we call it suboccipital, because this part of the head, your skull, is called the occiput. Okay, so these are areas just below or suboccipital, below the occiput. That's the origin of these issues that can contribute to the headache pain too. So you can see this. You can see these deep layers of muscles. There's a triangular group of muscles here at the suboccipital area, and all these nerves traveling up through that triangle. They even penetrate through those muscles, and anything that causes tension on that put pressure on those nerves, which creates pain in the neck and potentially headache pain as well. Now, Nathan was told he had migraine, but he did not. He had these suboccipital areas of tension that created the problem. And so the typical migraine treatments were not going to be effective for him because it did not get to the true source of the pain, and it did not consider the true root of his pain. So with all of these issues, what's going wrong? Some things that you can use to determine whether you've got a disc bulge or herniation issue versus stenosis. With a disc bulge, because the disc material moves in the younger person, you're going to be younger, 35 or below, and flexing is going to be harder on it. But when you have arthritis or stenosis, the flexion actually opens up that exit point for the nerve, and the disc material is not going to push back because it's not mobile enough. So flexion feels better, but extension or backward bending, looking up, is problematic for you. You're going to likely have arthritic related issues. Okay? All right. So let's go now from the types of pain into the true causes. And when I talk about the causes of neck and headache pain, I'm talking about what are the true culprits. And these are common problem areas that can manifest as problems in the neck. These things also manifest as problems in other areas too. If you have a history of neck pain and lower back pain, for example, what's the common denominator? Well, thoracic spine and hip issues are very much common denominators for these kind of issues. So let's talk a little bit about why hips need to be considered, why your thoracic spine needs to be considered, and why the foot and ankle need to be considered. And think again, remember I said that your neck is a three-dimensional mover? Sagittal plane flexion extension, rotation left and right, side bending left and right. The entire body is made up of three-dimensional parts that have to be moved and controlled in 3 dimensions. And we don't want to have too much mobility at the expense of stability, nor do we want to have too much stability. We need a combination. So that the phrase that I look for is throughout the body and all the moving parts, do we have most stability? A combination of mobility and stability, a happy balance. We call this Goldilocks. I talk a lot with my clients about the Goldilocks principle. Remember that story? Not too hard, not too soft, just right. Not too hot, not too cold, just right. In the body and all your moving parts, you need to have this just right balance between mobility and stability. And when you get too much mobility and not enough stability, that leads to problems. On the other hand, too much stability and not enough mobility is problematic as well. And with the case of the neck, it is usually too much stability that is the problem, but not too much stability at the cervical spine or at the neck. It's too much stability at other segments. And so let's look at an example of the hips. This is Nathan's example. Nathan had tight hamstrings. Now the hamstrings connect the sitting bones of the pelvis to the back of the knees. They're running on the back side of the upper leg. If they're exceptionally tight, it's going to roll the pelvis backward from the sitting bone. So you'll see that pelvis posteriorly rotates or tilts backwards. And when that pelvis rotates backwards, the spine starts to flatten at the lumbar spine. We get kyphotic at the thoracic spine, and the cervical spine actually then correctively looks up and extends. And so this is a big exaggeration. If Nathan hadn't been dealt with, maybe in 40 years, he would have looked more rounded like this. But when we looked at him, his pelvis was definitely rotated backwards, and he had a tightness in the hamstring issue. And when you sit like that, that facilitates that motion. That thoracic spine rounds a little bit more, and we are stuck in this head forward position. So that's loading some of the facet joints in the back of the neck. That's putting those suboccipital muscles in a short and tightened position, okay? And all the stuff that traveled through there, those nerves, were giving him headache pain. It was worse when he sat and then he bounced in the car. Driving in a car was no fun for him at all. Just driving across town in a small town was difficult for him. So think about that. This is just one particular movement of the hips. The hips are three-dimensional as well. So how well do your hips move, flexion, extension? How are they positioned with regard to the pelvis? Can they move side to side? Can they rotate? Limitations of rotation of the hip create lots of problems, some of which will manifest as neck pain and headache-related issues as well. So when we got his hamstring more mobile, he could tilt the pelvis forward. It created a better arc in his lower back. His head came up over his shoulders a little bit better. He wasn't sticking forward, and his muscles in that suboccipital region weren't locked down, putting pressure on those nerves. And so he saw significant relief within the first 2 weeks. It took about 5 or 6 weeks total for him to kind of get through this once and for all. All right, the second area, and I would say this is probably, in my experience, even more common than hip-related issues. How well does the mid-back, the thoracic spine, move? Okay, so now your thoracic spine has this rib cage. You can see all these ribs connecting to it. It does not move as much as the cervical spine above it, okay? It does not move as much as the lumbar spine below it, but it still has to move. And you have 12 segments, and each of those segments is responsible for about 3% of the motion in the spine itself. And it is not uncommon for people, as time goes by, particularly as we age, to lose mobility through the thoracic spine. So you'll notice people that swing their arms when they walk, maybe just a little, but they do not get much shoulder and trunk rotation when they walk like that. And so they get locked down, and usually they get tight through the chest muscles, and they get in that kyphotic position. See these shoulder blades here? These shoulder blades are amazing. There are 21 muscles that connect to each shoulder blade. Many of these muscles connect to your thoracic spine and up into your neck as well. So when that kyphotic thoracic spine gets locked in place, that shoulder blade isn't moving as much as it's supposed to, which negatively influences our ability to lift our arm well. We start to use secondary muscles like neck muscles to help lift the arm, and it all contributes to a lot of pressure on the cervical spine segments, those joints, the muscles, the nerves that travel through that area. And so we will often see a lockdown, rounded kyphotic thoracic spine, and you can expect you're going to have pressure on the neck as a result of that. Even though the cervical spine is made to move, with poor mobility in the thoracic spine, it's going to be asked to do even more. So the analogy I give are, think of it this way: 3 people on an assembly line, okay? Product comes by, each person does a third of the work, and it gets sent down and it gets sent off for delivery. It gets packaged and delivered, okay? And when each part's doing its job, when each person's doing its job the way it's supposed to, it's a nice system. But if one person says, you know what, I'm not going to do that, I don't feel like it, the other 2 got to pick up the slack, right? They have to compensate for what that one individual is no longer choosing or capable of doing, which isn't a problem for a day or a week or 2, but day in and day out. If 2 people are working hard because of what one isn't going to do for whatever reason, who's going to suffer from that? Okay, the one being asked to take on the additional load is going to wear down more quickly. We see this happening all the time in the human body. Your neck is saying, hey, I need help. But rubbing the neck, doing some treatments to the neck, that might feel good for a little while, but the true solution is making sure that that one person next to it in this case the thoracic spine, is capable of moving the way the thoracic spine is supposed to move. Thirdly, the ankle and feet are really important too. So I'm giving an example here of someone that has a poorly supportive left foot. Their foot pronates a little much. And if that is a true issue, if that left foot pronation overpronates, if that's the true issue, you can see the impact of that all the way up the kinetic chain. The knee knocks in a little bit more. The hip bumps out a little bit more. Because that pelvis settles, the spine's off to the left, and then it lifts up to the right a little bit. And then the neck has to make a compensation of that. So I have seen people who had really limited foot mobility or flat feet that we needed to set the system in a little bit more balanced way to take the stress off the areas as far away as the cervical spine. Now, I will say most often these kind of issues manifest closer. The close neighbors are most at risk, for sure, with this. But it can impact anything up that kinetic chain. And I've also found that most people with flat feet or fallen arches really have a hip problem. So we really might be talking about the true root issue is a hip problem that's influencing stresses that make the foot go flat, that are also increasing stress up the kinetic chain to the cervical spine and neck region as well. But the bottom line is, if you've dealt with neck pain and you haven't had someone take a look at areas beyond the neck, at the thoracic spine, at the hip, and at the feet, it is very likely the true problem area has been ignored. Okay? And the result is your neck's been picking up additional movement slack, and it's crying out for help. It's progressive trauma. And so what do you do about that? Well, to eliminate the pain, you got to find the problem. You got to go to the root cause. Okay? The most common treatments are not the most effective treatments because they simply alter, provide temporary pain relief, and in some cases, if it's an anti-inflammatory, it would actually delay actual healing. You can inject the neck with an anti-inflammatory, again, altering the problem, giving temporary relief, and delaying the real solution. Injection is really only 50% effective for most people anyway. I don't mind people, and so don't hear what I'm not saying. Sometimes doing some treatments that make people feel good are really, really important and necessary, but unless you've gotten to the root of the problem, we haven't given any solutions, really. Okay? So what I'm encouraging people to do is to seek an individualized solution that looks beyond just the neck. You got to see how that neck operates inside the dynamic system, which is the human body and the kinetic chain of movement that happens everywhere from where the foot hits the ground on upward. Okay? You need to be educated and empowered to do the right thing at the right time. And as you get better, what you need to do needs to change a little bit as well. Now, it is perfectly legal for me as a physical therapist to work with multiple people simultaneously. Even though that's legal, I don't think it's effective, and so I choose not to do that. I would encourage you not to choose anyone that does that as well, because that does not allow for the individualized care that you need. Now, there are some local hands-on mobilizations, even some manipulations that can be done that can feel good at the cervical spine. I do some of those things as well. That hands-on treatment can be effective, but particularly if you do hands-on treatment in a functional way. And some hands-on treatment to the area of the true problem, the movement deficit, really needs to be considered. And if you can do that with the foot on the ground and combining this with complementary motions, true functional movements where your neck has to learn to move well with the thoracic spine and the hip and the knee and the ankle, even better yet. Find and fix the root of the problem, and you can get this thing to go down below that symptom threshold instead of that cumulative trauma continuing to build. So the path you're on says it's going to get more frequent, more intense, and longer in duration unless you can find and fix the root of the problem. Okay, so I've given you a ton. I've squirted you with this fire hose, the fire hydrant, significantly. There are some things you're going to say that makes total sense. There's a lot of stuff I've already said that you've already forgotten, and that's normal. It's impossible to retain all of this stuff. And I'm going to encourage you. We like to say knowledge is power. I disagree with that, though. Knowledge is only powerful if you can implement it, okay? So I want to give you an option for finding and fixing your root cause issue that allows you not just to understand it, but to do something about it. And so if you want a true solution that lasts, you need to find the root problem, get the tools to practice and repeat it at home, and then repeat those things until the system is moving and working efficiently again. And so what I'm going to offer, you've been nice enough to listen to me for an hour here tonight. What I want to offer to you is this. You've heard this workshop. It cost you nothing but an hour. The next thing is going to cost you nothing at all except for 20 minutes. It's more personal. I want you to participate in what we're presenting to you is called the Natural Neck and Headache Pain Relief Consultation. You would come in and meet with one of our doctors of physical therapy who understand all this stuff just like I do. They will do some brief assessments of your thoracic spine, your hip, and your ankle, and they'll say, okay, here's what's going on. Here's what's type of neck pain you're dealing with. Here's the true root problem or problems, and here's what it would look like to get this into your rearview mirror, to actually do something about it that focuses on the heart of the matter, the true root cause of the problem, not just masking the issues. So that's the real benefit. Stop wasting time and money on things that, if anything, are only going to make you temporarily feel better, but not really get to the root of the problem. So you can take this thing and put it in the past and get your life back again. Okay? So the time that you would spend with one of these individuals, we're not going to charge you for it, but it's valuable. It's actually worth $150 when I compare it to national averages for that time spent. That's free to you. Normally we'd say, hey, get your money back free. Well, you're not spending any money, but we still want to give a guarantee. If you do this and say, you know what, it really didn't help me at all, just tell us and we will give $150 to your favorite charity. We like doing that, especially at the end of the year. We do a lot of that, but we've never had to do that for this because people find that 20-minute free assessment to be exceptionally valuable to them. At the very least, you're going to have a summary that says, okay, I know what's going on. I know what the primary culprits are, and I understand what it would take to fix this problem. Okay, so if you want to take us up on that, you got two things you can do. Either pull out your phone camera, go on that QR code, put it on there, you'll get a link. You can hit on that, and it goes to the spot on our website. You put your name down, your email, and you can decide one of our 8 clinic locations to have that screen done. What would probably be easier, though, if you want to do this and get to the root of the problem, and again, for no cost, spend that 20 minutes with a person that can find your specific needs. Just go in that comment box, that chat box, and say, yes, I want to get signed up. We have clinics in, Ames, Waukee, Des Moines, Newton, Colfax, Pella, Oskaloosa, and Centerville. So any of those you could choose. We do online too. So if you'd want to do some online options, there's means that we can assess movement efficiencies virtually if you prefer not to come into the clinic. I'll tell you, our clinics have been very safe places. We're doing a lot of cleaning and disinfecting, wearing the masks, socially distancing, all that stuff. So it's an okay option for if you're comfortable with that. Now, I'm leaving you some information here too. You've got my direct phone number. That's my cell phone, so you can text right to that if you have questions. This is my email address. It goes directly to my inbox. In an hour or so, you're going to get another email follow-up from me. On that, you'll have a link where you can sign up for the screen if you want to do it that way. You'll get a link that has this video, so you can watch it again if you want to. If you have people that you know that are dealing with headache or neck pain, send it to them. Let them watch that video too. We'd love for them to have that information. We want to share it. That's good information for anyone to have to get some solutions to this thing. You can respond to that email that you're going to receive as well. That gets to me eventually. That's a great way to do it as well. All right, so let me stop the share. I see some comments coming through on the chat. Betty, yes, I thought you're signed on for Ames right now. Great, good. Yes, so I apologize. Apparently there were some issues with the link not getting through to people. So we had a little delay in getting people logged on here tonight as well. So thanks for sticking with us and getting in here eventually. Tassie's on the ball, and Tassie got the technical issue figured out. So you were able to get signed up tonight. Any questions any of you have about neck pain, you can put in that chat button and I'll do my best to give you answers to that. First of all, Betty talked about cost. Remember that screen's no cost at all. That's free. We want to give that to you. We are, if at some point physical therapy is something you want to pursue with the knowledge of what you learn and getting to the root problem, do something about that. We're part of almost every insurance plan out there. So insurance should cover that. We would do a little checking on that. Our care coordinators will look into the benefits so you understand kind of what the financial responsibility would be for that. So, but that's not necessary right off the bat. The goal is to get that information first with that free injury screen. So there's between PTs and chiropractors. Well, there's certainly some overlap for sure. And I think there's some really good chiropractors that understand that the neck pain is not necessarily always a neck problem. They look beyond and kind of look at the whole system to some degree as well. I would say chiropractors are really good at mobilizing stuff. Physical therapists are a little bit better at bringing it all together and function, teaching them how to play in the sandbox together, understanding that eventually you got to get on your feet and do work, and move in space. Our expertise is bringing about that coordinated movement. Once we've created movement where the deficit exists, or maybe stability where the extra mobility exists with that. And so I personally believe chiropractors and PTs should work together much more than they do naturally. And we've been blessed to have great relationships with many chiropractors in our 7 to 8 clinic locations. So we've had some great sharing clients back and forth. We get referrals directly from chiropractors quite often as well. Betty's asking what the normal charges are. Well, it's a little bit tricky with insurance because it's all a little bit different. What we charge is not what we get paid. But I would tell you on average, we yield about $95 per session. And the average length of care that we have is about 9 sessions in about 5 weeks. So 9 sessions, each about $95. We end up yielding about $800 to $850 for a course of care. We help people from start to finish get through the problem and put it in their rearview mirror. Now, that does not mean that's what you're going to pay. You're going to pay whatever your insurance requirement is. That might be a copay. We get to the end of the year, many people have met, their deductibles, and so it may be much less expensive for you using that benefit. But unfortunately, that's a little bit different for every individual because insurance is a little bit convoluted. Honestly, we do have care coordinators and benefit specialists that do all that work to figure out that on the front end so that it's as known as possible on the front end if you elect to do something beyond just that free screen at that time, Betty. But if you have more questions about that, Betty, call Rachel and Ames and ask more of those questions. She does an awesome job getting to the bottom of that information and sharing that with people. All right, so all of you that are still on here, thank you once more for giving me an hour of your time. I want to be a resource for you, so I do not mind if you reach out to me at all, send me emails. During the day, I'm often quite busy, but I get to those emails at the end of the day or the early part of the following morning as well. David, are all the PTs in our clinics as knowledgeable as me? Well, I have the most experience at 24 years. That's a nice way of saying I'm the oldest. But all of these people have the same training. In fact, that's part of their training with us. They have to learn the way that we do things. So yes, this knowledge is not unique to me. All the people in our clinics have this comprehensive view and take a look at the entire movement system, the entire kinetic chain. So your experience will be very similar, whether you went to our Des Moines clinic and saw Todd, or a Waukee clinic and saw Patrick, or Cora in our Ames clinic. Very, very similar. Excellent therapists in all those locations. All right, Julie, you got the consultation in Oskaloosa. Awesome. I appreciate that you're going to set that up. We won't contact you then, Julie, if you've done that already. But if you need us to contact us, speak up here. That's good. David, would you like us to have one of the care coordinators call you to get something set up if you're interested in just learning about that? We'd be happy to do that. All right, folks, appreciate it very much. Don't hesitate to contact me if you have more questions. Enjoy the rest of your night.